Bonsoir, Madame la Ministre.
Hello.
Merci d'être avec nous.
Thank you for being with us. I know you don't have much time. I think you're going to be joining the Congress of the National Association of Rural Mayors in Bordeaux. First of all, what is the graduation of health offers do you tend to offer to users? You're on the territory. We would like to hear what you have to say. First of all, thank you for involving me in this edition of CHAM 2022. I'm very sorry I can't be with you. I was in Rennes this morning, and I have to go to Bordeaux for the meeting of the rural mayors tomorrow. You know that this is a major challenge because the medical resource is very rare and we need to adapt. This is one of the major works of the Ségur, with the coordinated in the health centres and the primary care centres and in the professional CPTSs. You know that the local hospitals constitute a first level of improvement of healthcare. This is a great link between all of the players, whether they're medical, social, or others. Behind this question, the question you ask raises the question of access to healthcare and the cooperation between professionals and assignment of tasks and territorial organization. Many important subjects for the government, as is shown by the creation of this ministry, which didn't exist and which I have the honor to be in charge of.
Certification médicale, vous le savez tous ici, c'est un phénomène généralisé. Dans 5 ans,
in 5 years' time, all of the zones of our national territory, to varying degrees, without exception, will be affected by a lack of density of medical professionals. How can we make sure we provide access to medical services? Everybody needs it. French citizens are worried about this quite rightly. So we want to get out of this top-down approach. There will not be a single approach, but differentiated approaches, because the inequalities vary according to different territories because of the name, due to the name of this ministry. And these solutions will be the same depending on whether we're in Le Havre, in Le Creuse, in Greater Paris, or in Chamonix. You're quite right to emphasize the importance of being close to users. We have to get out of this approach of being close to the supply, and we have to think of patients' needs. I think this is a theme of CHAM this year, and this is a part of our philosophy. The needs of our citizens are immediate, and there is an urgent matter. That's why it's important to set up pragmatic measures adapted to the needs of each territory, to the professional groups, graduation of care, and grouping of professionals, and telemedicine. Everything has to be discussed and put on the table. This will be the subject of the work we will carry out in the CNR, which will start on Monday in Le Mans with all of the stakeholders, and which will take place in all of the different regions. Minister, in fact, the real question is that when you said there aren't enough doctors, I'm not sure that's true. 8 days ago, at 3 o'clock, I went on several telemedicine sites. I found 9 appointments within 3 hours. What we haven't wanted to do in France is to look again at the role and the position of doctors in the health system. If you don't do that, you think there is a lack of doctors. This is not true. The GPs are there, and the nurses have to be on the front line. We shouldn't have to see a doctor before we see a nurse, otherwise you will not succeed. We're going to inject doctors into the system with the arrival of artificial intelligence and the increasing presence of nurses and other experts. What's going to remain for the NGOs, traditional doctors and family doctors? They're no longer any families. The families disintegrate and the children go in every direction. What are we going to do? We need to completely transform the system and look again at the role of the different players. If we continue with the primacy of the doctor as being the only person who can make a diagnosis or distribute a treatment, this is completely wrong. As a pharmacist, you should know this. Thank you for not asking any questions and for advocating your point of view. I said we are hard at work. If you could leave us a little more time, we'd be very happy. The fact that some professions are able to carry out vaccinations, for example, by nurses, this is a piece of work that is ongoing. It's not easy to do. You can't revolutionize a whole healthcare system in the blink of an eye. The role of telemedicine has to change, and we're aware of that, and become aware of that during the pandemic. And what you're saying here, well, if you could leave us a little more time and leave a little more time for the doctors to participate, who have come to participate around the table. The professions are working together. My ministry is the Ministry of Territorial Organization and Health. The professions are working together, I can assure you of that. We are working with them, and we should leave them a little more time, I think. The doctor will remain a doctor. The place we give to doctors in France is what it is. But leave us a little more time, and leave them a little more time to work together to find solutions. I can assure you that there is a shared determination to respond to the healthcare needs of our citizens, because everybody is aware that this is an urgent matter, and the healthcare professions too. We know that I'm not going to call and to dispute your commitment, and the name of your ministry is back. You should think about what I've just said, otherwise you're going to have huge problems. Are you going to support professions who include all of the local health services, prevention, rehabilitation, which are developing, for example, in Burgundy, with PS Concept, which already has several remarkable healthcare centres, which I recently visited. They have 4,000 square meters of the car park and radiology and biology testing facilities. They have the healthcare centres, which are going to develop, and there will be shops and commercial activities right around these healthcare centres. You have to reorganize the whole territory, not saying we're going to change this hospital, we're going to take the surgery away from the local hospitals and put it in the central hospitals. We have to go much further in thinking about the healthcare centres of tomorrow and to increase the attractiveness factors for the citizens. In Bonne, Chris, the optician, had to close its shop in the city centre and put it into the local healthcare centre. You have local medical care centres which are developing as well, which are remarkable. Are you really going to support them as much as possible without having legislation and ministerial decrees that put spanners in their works? Concerning your proposal and questions, there are several things. First of all, the healthcare centres only work if they integrate professionals for the professionals with the elected representatives in the local areas. If you don't do that with the cooperation of a local mayor, it won't work. Whether it has to be built with the healthcare professionals, with the support of the local municipalities. In any case, the professionals and the new professionals only want to work together and between different professions. And so these healthcare centres, I've visited several, and they work very well. And through that, you can see also that the difficulty is that the model that was ours, which is changing, of having a single healthcare professional available within a radius of 3 kilometers, with the creation of these healthcare centres, this kind of setup no longer exists. So how can we reorganize to make sure that all of our citizens who are remote, are isolated from these healthcare centres, are also able to get access to treatment? So we have to think of how we can reorganize the healthcare professionals, and this is perfectly legitimate and preferable, and also for citizens, because in the same healthcare centre, they're going to be able to get access to several specialists. So this is very useful. But how can we also meet the needs of citizens who are distant, away from these healthcare centres? You said I will be at the Rural Mayors Conference. I'm not sure that this single model will be satisfactory for the rural mayors, although they are aware of the model where a single doctor setting up their surgery in their village no longer works. So we have to have the healthcare centres, and also we have to have decentralised consultation and telemedicine as well. And this, you're quite right, and all of this system is something we're imagining and building and co-building with the healthcare professionals, all of the healthcare professionals, not just the doctors and the elected representatives. Well done. Another question. So you're going to go to this conference? I've already been invited to the Rural Mayors Conference previously. It's very interesting. There's a rather simplistic vision. You have to have the best possible surgery services, and it's impossible for that to be local. localized, and the French people have to realize this isn't possible. Are you going to tell the rural mayors that tomorrow they will have to travel 100 kilometers to have an operation? I have statistics about operations of prostates, which are very impressive. Some local hospitals only carry out 13 operations, and they have 50% more deaths than other operations. And are you going to tell the mayors about this and say that's enough? And you have to tell them that they have to accept a change. I won't say it. I usually have to say it. It's easier for you to say it from where you are than for me to say it from where I am, okay? I can't say it the same way as you do. But we are indeed in a system where we are at a turning point. I think there's a collective awareness now. And my role is perhaps to explain in a little more subtle way than you, perhaps. Maybe you can come with me. You can say what you want to say, and I'll say what I want to say. We're saying more or less the same thing, but I'm being a little bit more diplomatic, perhaps. But basically, yes, we will eventually have that system that you've described. But we have to do it in a radically moderate way, within a very educational way. This system is gradually being co-built. We don't have a choice in any case. It takes 10 years to train a doctor, as you said, or a GP, a little more for a specialist doctor. We have to reorganize our healthcare system, and we have to change the paradigm. We have to respond to healthcare needs and not create an offering of healthcare. This is how we're doing things. We're gradually building this. Not everybody has the same level of awareness. It needs a lot of education and information. But it is certainly necessary. We don't have any choice, and we will do this, and also at the same time respond to the concerns of mayors. I know the pressure that they are under as mayors, and I know that it is necessary for our co-citizens to have an answer will reassure them. So it's a question of finding this balance between providing responses to primary care needs, and we have to develop those responses, and at the same time develop health care and medicine and surgery, which will cover a much larger area than before. You can come with me. You can be the bad guy. I'll be the good guy. Bad cop, good cop. Yes, okay, it's very important. It could be a good way of working. Yes, a good Joe. What about the CNR, the Refoundation Council? We're all afraid that it's going to get stuck in convoluted discussions. I remember in '96, when the system of former soldiers in the US collapsed, there was a reinsurance system. At the time, President Clinton nominated a physician who explained this system, and he was given gave the 500 people from the trade unions, etc., in America to work on these issues, and he put them in a Hilton hotel, completely outside the administrations, and in 3.5 days, the white smoke came out of the chimney. As a result of the conclave, they're able to completely reorganize the veterans' sickness insurance system in the US. Our fear is that we're going to have a festival of PowerPoints, and nothing's going to happen. Please, make sure the CNR is quick. Put it in the Hotel Hilton or wherever you like on the seaside, and get people to work instead of just talking and not doing anything. Well, the CNR is not exactly this, as you describe it. We have already made progress, and we've already suggested some proposals to find solutions. The CNR is a forum where we will discuss subjects. The healthcare professionals will talk to the elected representatives and our co-citizens, and the politicians will also meet the citizens. The idea is of a kind of forum for discussion, but there's no diagnosis. You have it, I have it. We both agree on what needs to be done. The important thing is to be able to work on the territorial level, because there will be CNRs in every region. The important thing is to have responses in each area. That way we'll be able to develop toolkits and make proposals and not have to wait 6 or 7 years. No, not at all. The idea is to do it fairly quickly. As soon as we have ideas that work, is to offer them to our citizens and territories and to make progress, because I can tell you it's a very urgent matter, and we are fully aware of that. And from having worked very often in this system with the politicians and citizens and healthcare professionals, I know that we all have to work together to make progress. Thank you very much, Minister, for determination and commitment. You will win.